Baba Tando is standing by there. Now, Baba, thank you for joining us. We're hearing great news about Boris Johnson, but also an important update about the Ghanaian High Commissioner to the United Kingdom, Papa Owusu Nkrumah. What have you learned, Baba?
The biggest news, or the breaking news for me right now, is the fact that Ghana's High Commissioner to the UK, His Excellency Papa Owusu Nkrumah, has tested positive for the COVID-19, and he's currently in hospital in intensive care unit. But there's also some good news to it, because as I'm told by a close source to him, he is responding to treatment. So yes, indeed, Ghana's High Commissioner to the United Kingdom, Papa Owusu Nkrumah, has tested positive for COVID-19. He's in intensive care in hospital, and he's actually responding to treatment. So that's the news for you. But could you? There are 4 major talking points today. You've already mentioned one of it, that Boris Johnson is out of intensive care, but he's still in hospital and is also recovering very well. But the 3 other issues that have been issues of debates today on almost every media house have been about, what powers the police have. The police have gotten the backing of government to be more stringent, on I would say people who are tending to flout, a lot of the lockdown rules, especially here in London. And I must say that London is the hardest hit in all of the United Kingdom, with the highest number of confirmed cases. That's 13,378, and they also happen to have the most number of deaths, which is 1,907. So the police are actually going to be harder on people who tend to be flouting, all of these lockdown rules. And also, we're going to be sharing some news about TfL very soon. And TfL, Transport for London, basically they are the bus service for London. We're going to be hearing some major news coming out of that quarters very soon, because they are rising up. They are, there seems to be some uproar in that sector of the country, because they say that ever since this whole COVID-19 issue, they have yet to be supplied with personal protective equipment. They have nothing. If you go on a bus and you see a bus driver with a face mask or hand gloves or anything, the person or the driver would have purchased it himself, or would have provided himself with that. They have not been giving any equipment to keep them safe, and 14 drivers as we speak have died. And so this is causing some sort of an urgency, and very soon some of them are threatening to lay down their tools if nothing is done about the fact that they do not have any safety equipment with them. But the mayor of London, who tends to head TfL, that's Mayor Sadiq Khan, he says that he's going above and beyond the Public Health England advice to keep drivers safe, including providing antiviral sanitizers and protective equipment. And he says that unfortunately they can't provide every driver or every TfL staff protective equipment, and that would mean some 13 million equipment every single month. He says that cannot be done. And as we speak, Kojo, I earlier mentioned to you about the police. Now the police could possibly start searching the bags of shoppers, and if you happen to be in any of the shops and you're not shopping for essentials, you could be fined on the spot. I don't know how this is going to happen, but they say they are going to do it. And you only have to go out to buy essentials. So for instance, you can't go out and say you're going to buy a bar of chocolate or you're going to buy candies or whatever. You need to go for essential items. And also they are also telling people who are constantly on the streets with the excuse of exercising that you can only do that for just 1 hour in a day. If you do more than that, there will be problems. How they're going to go about that one, I won't be able to tell. And then also, Kujo, the German army, I don't know if you've heard about this, but the German army is donating some 60 mobile ventilators to the National Health Service, that's the NHS. Currently the NHS has 10,000. they actually need 18,000, and the German army is giving them some, 60 mobile ventilators, which will mean that it will go a long way to boost, the NHS. The NHS currently is also, I would say they are under pressure, especially when it comes to, PPEs. They say there's a shortage of PPEs, and frontline workers are beginning to complain because the death toll over in that area is also rising by the day. So it's not been an easy one for for most sectors of the UK. And then the applauses keep coming. The NHS, frontline workers, care workers keep getting the applauses that they deserve, from the nationals. Just in a way of showing appreciation for everything that they are doing and they have done and are doing so far. Kojo, and then we can also talk about, the interventions that have been promised. As we speak, the government is only saying that it's only up until June, and even that one, the one in June, is only going to be for self-employed people. These are going to be some sort of reimbursement schemes, and that would be solely for self-employed people. So I don't know about the others who are in other forms of employment. So that would be it for the interventions that are coming up. And it happens to be Good Friday. I don't know how it is going in Ghana, but over here in the UK, and especially in London, there are virtual messages, from most churches. It's just been virtual messages going on around. And the churches are saying for a very long time, ever since they got involved in, streaming online their services and all of that, they seem to be getting a high patronage. And especially for today being Good Friday, their services were, their sermons or the church services were actually highly patronized online than it has been in previous times. And so, Kojo, these are a few of the issues that are going on. If you have anything else you want to ask me.
Baba, it's amazing how you answer every question in my head before I get the chance to ask it. But you have certainly given us a very comprehensive update there of what's happening in the United Kingdom. I suppose one thing I'd be interested in knowing is whether or not the Ghanaian community are doing anything as a community to combat COVID-19. What sort of activity have you been monitoring?
Well, Kojo, unfortunately, the Ghanaian community has not been able to come together as a unit, to do anything. What they do is to send messages around. They are doing this virtually. You won't see them meeting up or, unless, they have these meetings, like I've said, virtually. But there's also one problem, which has been raised by a number of people. People are beginning to complain that there isn't too much information out there, especially from the GPs and surgeries. They say they don't have any information at all, especially on, for instance, if you come to Mitcham, people in Mitcham would like to know how many people in Mitcham have actually contracted the virus, or what's the current state, with the situation. They have no such information when they go to their GPs or the surgeries, which is the most ideal place to get this kind of information from. And so this is also beginning to tell on the people, and they are agitating. People want to know. It looks like what's happening online, what's happening on the television, what's happening on radio seems not to be enough. So they would want their GPs and surgeries to be well equipped to give them as much information as possible, so they can, they can know their next line of action. And as we speak, looks more like UK is going to be in lockdown for quite a longer period than anyone expected.
Baba Tando there, reporting from the United Kingdom, from London, which is the epicenter, unfortunately, of COVID-19 in the United Kingdom. Baba, thank you ever so much, and let's stay on top of what's happening with Papa Owusu Nkrumah if we can.